relevance. Here's an overview of the approach. There are basically two main steps. There's an orientation and a functional assessment. Those are the two. An informed consent essentially is the orientation, then a functional assessment. Those are the two main steps. And these, just to clarify, I believe these have to be done with all patients. All patients. If the assessment reveals that something is worthy of discussion, then we can evaluate spiritual resources, spiritual struggles, and spiritual symptoms. And you're all familiar at this point with what those are. So we'll capitalize on that in this assessment. Okay, so we're going to focus on an orientation and informed consent and functional assessment for now, and then we'll move on. And this is with all patients. Okay, as with any intervention, we always want to get informed consent. So there are many ways to ask this. It doesn't have to be a signed informed consent procedure. It doesn't have to, you don't need retinal scans and thumbprints and, and even if you work at the VA, you don't need that. You don't need a magnetic card swipes and, it doesn't have to be technical or formal, but it does have to be asked, would you mind if I asked you about your spirituality? How important is spirituality in your life? Has it always been that way? What are some of your beliefs, some of your practices? The point here isn't to assess for importance of religion or what their beliefs are. I mean, you might get some data, great, but the point here is to make an overture that, hey, I ask all my patients about sensitive topics. I ask them about sex, I ask them about money, I ask them about politics, maybe not, especially today. And I ask them about religion. Is this relevant to you? Is spirituality something that's relevant? Is it something that we can talk about? And if somebody says no, I have never had a patient say no. Actually, that's not true. I've had one or two ever out of tens of thousands who said, no, you know what, next topic. But it's rare, it's very rare. The objectives here are open it up for discussion, make an overture. A lot of patients will say that they've never had the opportunity before to speak about spirituality in therapy. A lot of patients, people who have been through the system a lot, they will say, nobody's ever asked me about that. This is really unique. I had a patient once back in 2013, a woman in her early 20s. She was a seasoned psychotherapy patient, many years. She had been hospitalized for anorexia and depression in early teenage years. And I asked her about spirituality. She's like, well, you mean I can talk about God in here? I'm like, sure. Wow, she said, that would be a whole new level of therapy. Like, oh, it's a whole new level. So often patients don't see it coming. They don't expect it. And I think that it's important to, make it available if they so choose. And by the way, you might get some data like what their spiritual beliefs are. All of that's fine, but the main point is informed consent. And also to orient them, hey, let's chat about this. Do you want to? The second step is the heart of the assessment. Again, I don't think there is any more important question that we can ask to any patient about spiritual life than this, which is, how is your spirituality or religion relevant to your symptoms? How is it relevant to your symptoms? How is it relevant to your treatment? We can be more specific, like, do you rely on spirituality to cope? Does it help you? Does it make your symptoms worse? Do you have any symptoms that do they fluctuate in concert with your spirituality? Does your spirituality fluctuate in concert with your symptoms? Do you have any spiritual symptoms? Are any of the symptoms you're having of a spiritual nature? This is called a functional assessment in CBT terms. Other modalities might have different words for it, but it's essentially, you're looking at how is something relevant? How is X relevant to Y? And you would do this for any area. How is your relationship relevant to your depression? How is your employment relevant to your anxiety? So, a functional assessment.